Based on the provided search results, here is a comprehensive overview of various contraceptive methods. Hormonal methods. Oral contraceptives, both combination and progestin-only pills, are effective in preventing pregnancy, with a failure rate of 9 per 100 women in the first year of typical use. Then we have the patch and ring, which are hormonal patches and rings that release estrogen and progesterone, with a failure rate of 0.3 per 100 women in the first year of typical use. Lastly, the shot, also known as Depo-Provera, is a hormonal injection that prevents ovulation, with a failure rate of 0.3 per 100 women in the first year of typical use. Intrauterine devices, or IUDs. Hormonal IUDs, such as Mirena, Skyla, and Liletta, release progestin to prevent ovulation and thicken cervical mucus, with a failure rate of 0.2 per 100 women in the first year of typical use. On the other hand, copper IUDs like Paragard prevent fertilization by interfering with sperm, with a failure rate of 0.6 per 100 women in the first year of typical use. Barrier methods. Condoms prevent sperm from reaching the egg, with a failure rate of 18 per 100 women in the first year of typical use. Spermicides are chemicals inserted into the vagina to kill sperm, with a failure rate of 29 per 100 women in the first year of typical use. The diaphragm and cervical cap are physical barriers that cover the cervix, with a failure rate of 6 to 12 per 100 women in the first year of typical use. Finally, female condoms, which are polyurethane condoms worn by the woman, have a failure rate of 21 per 100 women in the first year of typical use. Sterilization. Female tubal ligation surgery that blocks the fallopian tubes, with a failure rate of 0.5 per 100 women. Male vasectomy, surgery that cuts and seals the vas deferens, with a failure rate of 0.15 per 100 men. Natural family planning, NFP methods. Rhythm method, tracking basal body temperature and cervical mucus to avoid fertile windows, with a failure rate of 22 per 100 women in the first year of typical use. Billings method, observing cervical mucus patterns to determine fertility, with a failure rate of 20 per 100 women in the first year of typical use. Fertility awareness-based methods, FABIEMs, combining temperature, cervical mucus, and basal body temperature to determine fertility, with a failure rate of 15 to 20 per 100 women in the first year of typical use. Emergency contraception, Plan B one-step and generic versions. Hormonal pills taken within 72 hours of unprotected sex to prevent pregnancy, with a failure rate of 0.1 to 0.3 per 100 women. Key considerations. Effectiveness varies depending on method, user adherence, and individual factors. Some methods have additional benefits, such as reducing the risk of sexually transmitted infections or providing protection against certain cancers. It's essential to discuss individual needs and preferences with a healthcare provider to determine the most suitable contraceptive method. Remember, this information is based on the provided search results and may not be exhaustive. It's crucial to consult a healthcare provider for personalized guidance on choosing a birth control method. Best contraceptive methods. Based on effectiveness and convenience, the top-rated contraceptive methods are long-acting reversible contraception, LARC. Intrauterine device, IUD, highly effective at 99% and long-lasting up to 12 years with two types, hormonal, Mirena, and copper, Paragard. Contraceptive implant, effective at 99% and lasting up to 3 years, with a small, flexible rod inserted in the arm. Barrier contraception. Condoms, effective, 71 to 88%, and available over the counter, providing dual protection against pregnancy and sexually transmitted infections. Combination. Using condoms with another method, such as spermicide or hormonal contraception, can increase effectiveness. Other effective methods. Hormonal contraceptives. The pill, ring, patch, and shot are effective, 91 to 94% when used correctly, but require daily or weekly use. Emergency contraception. Available over the counter or by prescription, emergency contraception pills or copper IUDs can reduce pregnancy risk within 5 days of unprotected sex. Important notes. All methods require proper use and maintenance for optimal effectiveness. Combining methods can increase effectiveness, but may also increase risk of side effects. It's essential to discuss your individual needs and health status with a healthcare provider to determine the best contraceptive method for you. Remember, the most effective method is one that you will use consistently and correctly. Consult with a healthcare provider to determine the best option for your reproductive health and well-being. If you find this video informative, please like, share, and subscribe for more such informative videos.